Some doctors today are afraid, others are indifferent. Many think, AI? Not my problem, but they're all wrong. Artificial intelligence is not just knocking on the door of medicine, it's already inside the operating room. As we speak, new generations of doctors are entering universities where diagnostic tools are powered by deep learning, treatment plans are drafted by machine learning, and patients are monitored by autonomous systems 24/7. The real question is not if AI will reshape medicine, but how deeply it will change the doctor's role itself. So what will the medical world look like in 2035? Let's ask the one who already lives in that future, AI itself. Here's a vision of what's coming. The 5 incredible ways AI might save lives, and the 5 dangerous ways it might ruin them. 5 ways AI will save lives. 1. Hyper-accurate diagnosis. AI will detect diseases earlier and more precisely than any human ever could, especially cancers, rare disorders, or genetic anomalies. 2. 24/7 patient monitoring. Wearables and implants powered by AI will alert doctors before a crisis happens. Heart attacks, strokes, or glucose crashes. 3. Rural and remote medicine. Drones and AI telemedicine systems will bring expert care to the most isolated places, from mountains to war zones. 4. Personalized treatments. Using your DNA, lifestyle, and real-time data, AI will craft personalized treatment plans for every patient. 5. Augmented surgeries. AI-powered robots will assist in surgery with micron-level precision, reducing risks, errors, and recovery time. But even the brightest tools can cast long shadows. Let's turn the table. 5 ways AI might ruin lives. 1. Loss of empathy. AI can't hold a hand, feel grief, or give hope, but future doctors might forget how to. 2. Over-reliance. When doctors start trusting machines blindly, mistakes become systemic and invisible. 3. Data vulnerability. Medical data hacked or sold could destroy lives. Privacy might become a luxury. 4. Algorithmic bias. AI trained on biased data may give worse care to minorities, women, or rare cases. 5. Job displacement. Some medical roles will vanish. Radiologists, technicians, even some GPs might be replaced, not assisted. In 2035, doctors won't work alone. They'll work with AI or against it, knowingly or not. The best doctors of the future? Not those who fear AI. Not those who ignore it, but those who understand it, master it, and stay human. Because in the end, life will always need a human touch.